Good afternoon, and welcome to this noontime hour of our office hours for the month of October. We do have a full agenda, big presentation, so I'm going to go ahead and jump right in. Welcome to the office hours, like I said. All right. This is our agenda for today. We'll really quickly just hit that. We're not going to go through each item because we are going to go through those as we go through the presentation. First off, I would just like to say thank you to Carolina Complete Health, and we work in conjunction with CCH as our physical health plan partner, and we work as in a partnership to provide those physical health payer services that are needed to ensure that you receive your payments, that our members in the tailored plan receive the services that they need and desire. So thank you to CCH, and we'll move right on. We do have some initiatives that we're going to talk about today. The first of which is just to make a note that we do have a mammogram, neighborhood mammogram, mobile mammogram series set up to start in October. The first one is set up for October the 27th from 9 a.m. until 4 p.m. There is more information if you will follow this this link here on the screen. There's a phone number here that you can call to set up an appointment for those members, or those members can call to schedule their mammograms. Mammograms are super important, as we all know, and I would encourage you to make sure that your patients are aware of that and that they are able to schedule those free mammograms. Next, we're going to talk about the kit, as we lovingly call it. It's our known issues tracker. And just to give you some indications of what types of issues that we are seeing in the system currently. Some of these are older than others, but we do like to keep you abreast of those items to make sure that you know that these are happening. We will give you, there's some links that you can go to look at the most current ones on file. If you go to the CCH website, you are able to access that kit there. There's a couple of more issues here. There is some issue that was in, this was around May, an issue identified with member enrollment that were causing claims to deny with a denial code of L6. Please submit to primary insurer. And we would just remind you that if they do have primary insurance in addition to Medicaid, that does have to be billed first, and that the expectation is you get the results back and you send that explanation of benefits over along with that secondary claim to have the Medicaid pay the rest of the bill, what's outstanding. Claims configuration issue. There were some gaps identified in the hierarchy back when around routing for physical health versus behavioral health claims. Again, we'll talk some more about what you can do to ensure that your claims are routed properly with your payer IDs and how that hierarchy works in the system to ensure that those are paid properly as a physical health or behavioral health claim. We'll move right into hot topics. And the first item on our list is just to make sure that you are aware that there is a new credentialing committee that's going on at the state level. That first meeting is going to be set for, it's actually tomorrow, October the 8th. For more information around this, there is a link here that you can go and read the bulletin around that to get some more information. You've got questions that you can send questions to at the Medicaid Credentialing Committee stakeholders email. And also, here is the Credentialing Committee blog if you would like to find out more about that. I encourage you to go out. This is a new process that's being put in place for credentialing at the NC Tracts level so that providers are being credentialed through that mechanism. Just a reminder that October 1st was the EVV Home Health Hard Launch date. And just want to make sure that all of your claims that are submitted after October 1st will no longer be paid unless you have that EVV visit data loaded into that system. We do have a resource page that you can go to on the website to get all the information and everything that you want to know about EVV Home Health Hard Launch. There are bulletins out there. There are links here that will take you to that electronic visit verification home health page at the state and department level. And there are questions, email that you can send to if you have if you need assistance. Please use our email and don't hesitate to reach out. We have a whole support team that's available to assist you, and that email is evvsupport@partnersbhm.org. We need to give you some update around NEMT, or non-emergency medical transportation. If you've seen it in the news, or if you have heard it by way of going to the website, Motive Care, who is our NEMT provider, they filed for voluntary Chapter 11 protection on August the 20th in bankruptcy court. The reason that we're bringing that up is that we want you to know that the services should not change while they're restructuring. They are working on updating and restructuring their business to come in line with what they need to, and they want the main thing is that they're still going to provide services. Your members or patients are still going to have access to transportation, and the claim submissions are still going to come in the same way. But if you do have questions around that, we have a provider services line that we encourage you to call to ask more questions. It's 1-877-398-4145. That's your first line of defense. Anytime that you have a question, if you are a provider, to please call our provider services line. We have staff available 6 days a week to answer any calls that you may have around issues that regarding provider issues. And we do have a full press release included in here with the link that you can go to and click on and read all of the information more in depth than what we have shared here. There are some key changes to the provider application process in the NC TRACS provider enrollment system. There are some additional questions that you're going to have to answer around exclusion and sanctions on the enrollment application. So here's a link here that can give you more information around how that's going to happen and what you can expect. There's also a new attestation process that's been created where you will have to attest that the information that you have entered onto your enrollment application is valid, accurate, and true to the best of your knowledge. So please note that that is a new requirement that is going to be out there for NC TRACS enrollment. And also there will be a demographic data collection on the provider applications going forward. You will have the opportunity to capture race, ethnicity, and languages spoken. This helps in the dissemination of information for our members and patients as they are looking for providers. That helps to identify gaps in services around these areas where we need some capacity, if you will. So just wanted to make you aware of those changes that are coming through that enrollment process at the NC TRACS level. An important update that we need to provide is that the GLP-1 coverage that has been available for not just diagnostic reasons, but also for weight loss, that is changing in the Medicaid arena. Letters have been mailed out to all of the members that currently have those medications. It will no longer be covered for weight loss only. But if you do receive the GLP-1 medications for diabetes, some heart conditions, in some areas, I think maybe even pre-diabetes, your doctor can help decide what is best for you, and they can still request that those prescriptions be covered for those other reasons that outside of weight loss. So I want to talk a little bit, a hot topic that a lot of folks are asking about, or about the rate reductions that started, went into effect at the DHHS level October 1st. We do have a bulletin, Partners has a bulletin out to give you what our plan is. We have worked in conjunction and in association with the other tailored plans, and the thing that you need to know is that we are delaying that implementation to go into effect in November the 1st, but it will be retroactive to services that were delivered and billed as of October 1st. So please note that if you have claims that you bill in October, that those will be paid at the prior rate that was on the fee schedules, but also note that come November 1st, we will be going back and doing a review of those services that have been billed. And if the rate was an area where those rates are reduced, then those services will be re-adjudicated and recouped according to the updated fee schedules. We have included a note from North Carolina DHHS here that they just want everyone to know they are still committed to transparency The fee schedules are here linked here in this note around the rate reductions that you can click on. You can go out and see which which services were impacted by the rate reductions. And there's also a note to please note that if the additional appropriations are found, they've kind of left that open, then that is subject to change if they find additional funding for that. There is a question and answer document that you can link that is linked here, and there is an email that you can send Medicaid provider reimbursement at dhhsnc.gov that you can send your questions to. Some other important updates are there are new signature requirements for nursing facility level of care forms. Please note that. There is a link here to that bulletin and those forms so that you are aware of what those changes are. There have been enhancements made to the PDN prior approval and claims processing that was effective back in July. NC Tracks is implementing system enhancements to improve the processing of private duty nursing. That's what PDN stands for prior approvals and claims. And the bulletin applies to in North Carolina Medicaid Direct. So please note that link is here and you can go out and get more information if that affects your practice. More updates that we have for you. There is updated coverage for psychiatric collaborative care management as of September the 17th. There is a bulletin out there around the code 99494. If that affects your practice or you as a provider, I would encourage you to go out and check out this blog to give you more information around the collaborative care management. There's also updated guidance for North Carolina Medicaid payments around Planned Parenthood. There's additional information around new federal prohibitions on certain providers. Please go out and check that if you feel like that affects your practice or you need more information about that, or you're just interested to see what's happening at that higher level. The next update is going to join with the slide that's following. Just a reminder that the tobacco-related policy requirements that came down from the department level have been delayed until January 1st, 2027. Here is the Medicaid blog regarding that, and then you can click on that. And the next slide is going to give you some additional resource information for your county, as well as resources internal to partners that you can access to give you more information on how to be working on that implementation when it does go live in January of 2027. We are excited to share that there is a new chronic condition management program for asthma and diabetes. It launched back in June. There are programs that are associated with this. They are short-term, lasting typically 6 to 7 weeks. As you'll see, there is a link below on the slide that you can go and find the most updated programs, the most current programs, so that you're able to access those programs for your patients if that is needed, and just to see which one is current and which one could apply. This is just a reminder of the Medicaid Managed Care webinar series that we typically have the back porch chats in the spring, and then in the wintertime it changes to the fireside chats. So this is just a reminder of those dates, and those topics are to be determined. There is a registration link at the bottom of this slide that you can access to register for those back porch or fireside chats to get all the latest and greatest information on what's happening at that state level. Just want to give a couple of provider department communications. There is a spring update communication that gives you information about Ombudsman, CFSP, which is the Child and Family Specialty Plan, and upcoming credentialing changes, which we spoke about just a little bit earlier around that credentialing committee. There is a blog that you can go out and get that update information if you want to. As well as EVV for home health care services and direct billing. Here is again the link that will take you out to the blog that talks about the EVV home health care services direct billing, which again went in hard launch as of October the 1st. Some updates for providers and member referrals. We continue to get feedback that providers are suggesting at times that patients change their eligibility from the tailored plan to another insurance carrier. If that is due to issues around referrals, we would like to know that. We would like to have some opportunity to work with you as a provider in order to know where those struggles are, where those barriers are. If you are struggling to find providers to take referrals, or if you're struggling to take referrals because of some type of barrier, please reach out to our physical health provider account specialist team so that we might support outreaching whatever provider you're struggling or having a barrier with to make a referral to, or if you are having barriers yourself as far as receiving referrals, whatever that might be. I would just encourage you to reach out and let us assist with that and see what we can do to provide some support in those areas. We're going to talk about the skilled nursing facility referral process for just a moment. Our utilization management team, which does include Carolina Complete Health, collaborates with hospital discharge planners to identify members that are transitioning from acute care over to a skilled nursing facility. The skilled nursing facility submits a request for admission to partners. That medical necessity is then reviewed by our utilization management department, and once that is approved, partners will then send that authorization, and that SNF is required to submit a GMT20251007 form to DSS to initiate that financial eligibility review. A PASSAR Level 1 screening is required. If positive, then a Level 2 evaluation ensures that the appropriate placement for those individuals with severely mentally ill or with IDD. And if you have any questions around that, please contact our care transition team for information on that. At the CTT, you can see the long email there, but that is our care transitions team, and we encourage you to send your questions around that if you have them, so that we're able to support you in that process. We do have some frequently asked questions that we want to share. Are referrals to specialists required? Short answer, no. Members can seek an in-network specialist without a referral. And members are encouraged to seek consultation first from their primary care provider so that they're able to then have that support they need at that PCP level. And then PCPs are encouraged to coordinate those care to those specialists and providers. Prior authorization may or may not apply. We'll talk about authorizations in just a little while and how to look up whether that prior authorization is required or not. What are the copay rules around Medicaid? Well, the copays at this plan level, we follow those established North Carolina Medicaid copay rules, and there is a link here that you can read more about that. So those are consistent across all Medicaid plans. So how do I know which CPT code and modifier to use and if it's covered? We adhere to the North Carolina Medicaid fee schedule and covered services for physical health plan services. There is a North Carolina DHHS Service Now page. This is a link that you can click on to take and give you more information around that. And as well, like I said in the first bullet, we will talk more about how you can tell locally if that service is required and if it requires an authorization or not. So around tailored plan care management communications with primary care practices, contact information. So for us, North Carolina Tracks is the source of truth for a TCM assignment. If there are questions that remain after checking NC Tracks for that care management assignment, you are welcome, and we encourage you to reach out to our Care Connections team through a single email group distribution that's called, and screening and referral that you can reach out to there. We also have our member services line that's available if you have questions or need more information. I would encourage you to call our member and recipient services line. It is available Monday through Saturday, 7 a.m. to 6, and there it shows you the number. It's 188-235-HELP or 4673, or relay North Carolina 711, or for and we do have that available, yes, for English and Spanish speaking. So just want to make you aware there's a no wrong door, and we have that available for any need that you have. So how do you make a referral for Partners Tailored Care Management? You can email Partners a referral for Tailored Care Management through the screening and referral at partnersphm.org email. What we do ask is that you please include the member Medicaid number on the email. The team will then pick that up, verify that member's eligibility for tailored care management. They will find out if they're already connected to tailored care management, and they will follow up with the primary care practice who made the referral to close that loop and ensure that that practice is aware that tailored care management is available or already in place for this member and who that tailored care manager is. Typically, that's done within the same business day or the next business day for follow-up. We're going to move into value-added services and incentives. I will get that out. Thank you. Just wanted you to be aware that we do have some value-added services. One of those is prenatal Strong Start. Here is some information around that. There's a link here that you can go and get more information on that or to sign up for that program. This program is for pregnant members who complete a notification of pregnancy intake form and are engaged in care management. It will include a pregnancy kit, breast pump for those who meet the eligibility criteria. They get a choice of one of these following items. There is opportunities to attend community baby showers. And there are some monetary incentives for attending up to 3 prenatal visits. So we encourage you to check this out on our website to make sure that that if you have members that fall into these categories, that they know that if they're eligible or not, and they can complete this pregnancy form to become eligible for these items. Have a couple more value-added services and incentives here for you. For youth, there is a Free to Breathe initiative. Here is the form for that to sign up for that program. This includes coaching, an asthma kit containing items such as mattress covers, pillow covers, access to our health library for additional education related to asthma that members may need. It is available for children and adolescents 18 years old and under with a current asthma diagnosis. There's other value added service, Mobile Connect. That is a smartphone program that is available for free calls from providers, care managers, pharmacies, and important contacts, as funds available for members who have exhausted a once-in-a-lifetime SafeLink phone. So just want to be aware that that's available as well. And last, in our value-added services, there is some wellness incentives that are available to our members. There is a $10 reward for PICS Health app registration. Our PICS Health app is an app that is used by our members, directly by our members. They engage with this app. It's a wellness app. I would encourage you to go out into our website and find more information about the PICS app. We have whole slide decks out there that are available for that. I would encourage you to check those out and encourage our members to use those apps, because it is it helps them in their daily walk, if you will. Mobile wellness apps and Healthy Reward 18 and up to provide support. This is just going in again what I just said about the PICS app. There are $25 gift cards for completing a care needs screening. $20 gift cards, Healthy Rewards for attending annual wellness appointments, and then the Living Tobacco Free program for tobacco cessation. So just want to make sure that everyone knows those are available for those members. And if you have any questions, please reach out to our provider services line or check on our website for more information. So we're going to move into some of the more technical pieces of our office hours now. So we're going to talk about our member ID cards and eligibility checks, and that we're going to move into that. So Partners is always committed to providing our members with the best possible primary care provider choices available to them. However, members sometimes are not able to choose their preferred doctor's office due to panel limits. So when we talk about a panel limit, we're referring to the maximum number of members that a physician can manage in their practice, or the capacity that they have. This limit is determined by such factors as their available times, the complexity of the members' needs, and their capacity to make sure that they can provide that quality care to all of those members who have chosen them as their PCP. So maintaining that appropriate panel size is critical and essential to being sure that the doctor's office can provide adequate attention, prevent burnout, and improve that care quality in their practice and for those members overall. If the panel limit has been reached and we cannot confirm that the member had an established relationship prior to with that provider, we do require some documentation to assign that member to that PCP. The provider can submit a letter on their letterhead, including that member's name, Medicaid ID, identifying information to confirm that this person did have an established relationship or that they would like to accept this member into their practice. Alternatively, can accept a claims history showing that, that there's at least 6 months of primary care treatment with this member and this provider relationship. That documentation can be sent by email to pcp@partnersbhm.org, or it can be faxed in as well, and put attention on that cover sheet to member PCP choice. If you have further questions around PCP member choice, you can contact our member engagement support specialist, and it gives you a phone number. And then there is a bulletin around this. There's a link there that you can go check. That bulletin will give you additional information. This is a sample of what a member ID card looks like, and you can check the member eligibility as well through NC Tracks, through our Provider Connect portal, which we'll talk more about a little later in this presentation, or you can call our provider services line to verify that eligibility here at 1-877-398-4145. I would like to make a note that it's not required for the member to have their card on them when they enter your office. That is not a requirement of partners that they have their card on their person when they attend for a visit. You have multiple ways to verify that eligibility without having that card present. Of course, that's the ideal thing, of course. But just like to put that out there, that is not a requirement for a member to be seen for your services. So if they don't have it at that point in time, you can check eligibility through these other mechanisms and be sure that they have coverage. So checking eligibility in NC Tracks, if you look it up in NC Tracks, we're going to show you an example of what that looks like here on the next slide so that you can tell quickly that they are a tailored plan Medicaid managed care member. If you see tailored care management, seeing a tailored care management provider does not indicate TP eligibility because there are Medicaid direct members that are also eligible for tailored care management. Here is an example of a Medicaid direct example that shows you what it looks like. If you see at the top in the red box, that shows the benefit plan just as Medicaid, and it shows in this bottom managed care box, it shows managed care for behavioral health services. This is how you identify that it is a Medicaid direct member, and tailored care manager listed is not an indication they are a tailored plan member because they can't be eligible for that as a Medicaid direct member as well. But if there is a tailored care manager listed, then they are eligible for tailored care management, but they could still be Medicaid direct. So just to give you an indication what that looks like when you look it up in NC Tracks. If they are a tailored plan member, the eligibility is going to look like this. It's going to have North Carolina, or it's going to have MC, Medicaid carve-out plan, and it's going to have TPMC, tailored plan Medicaid managed care. That's going to show you that that's a tailored plan member. So these are good cheat sheets, if you will, in an office at a front desk. Whoever's verifying that eligibility might want to have a copy of these, and you can go pull these out of this slide deck as it's posted, because it will be posted later for you to be able to go review this as an on-demand. And it's good for them to have this information if you've got a new staff person, for example, who needs to know what they're looking at when they go into NC Track. This is a quick screenshot to help them be able to identify that. Next, we're going to move into our provider portal. We use Provider Connect as our portal, and of course, before you can have access to that, that portal connection needs to be set up. If you are a provider who has not yet set up Provider Connect, you will need to have a portal administrator complete a setup form, and here's a link to that SurveyMonkey form. And then once that portal administrator is identified, or local administrator is identified, then they can set up the rest of the users at your organization. Please note that that has to be done first before any members can be set up. You need to make sure that you have that local administrator or portal administrator identified and set up into portal. If you have questions about the form, you can contact the credentialing team at Partners And if you are unsure, if you already have a local administrator, here's a link that you can go that takes you to our website that gives you a list of all the provider organizations and who the local administrator is. So if you're a new staff person, let's say at a hospital system, and you need to know, I need to know, I'm going to be responsible for this. How do I know how to get connected? You can go out there and you can identify that your organization has a local administrator already. Then you'll know who to contact at your organization to have you set up as a user. There's additional information on Provider Connect here linked in these links below on this slide that will give you more information about what we just talked about on how to get that set up, how to identify that local administrator, and so forth and so on. All right, let's move on into authorizations. We're going to talk about how to obtain authorizations in physical health. All right, I said this a little earlier, and we're going to talk more about it now. So this is what is called our prior authorization or pre-authorization lookup tool. There's a link here on the slide that takes you directly there onto the website, and you were able to type in the code. If you know your procedure code or your HCPCS CPT code, you can enter that, as well as the option to enter modifiers if there are modifiers that go along with that. Click search, and it's going to return to you a result that tells you whether or not that service requires a modifier, or requires an authorization. So I encourage you to use this lookup tool if you are unsure if your service that you are going to be providing or that you provide requires an authorization. That will help you work some of that on the front end, and instead of having to worry about trying to backtrack and try to get an authorization on the back end. There's a couple of ways you can submit authorizations. If you use our Provider Connect portal, then you can use ProAuth. That is the way you can submit those electronically. And that is, of course, the preferred method of service authorization request submission. And that will probably give you the fastest turnaround time as well, because it's going to go directly into the system for someone to pick it up and look at and make sure that they are then addressing and processing that authorization request. But we do have a manual submission process. If you are not currently in network, or if your system is down, your phones are down, or not phones down, but your system is down and you don't have your internet at the current time for some reason, there's a blip. You can do that through telephone, or you can fax or email from another. You can attach a manual authorization request form if you need to do that. If for some reason you need to do that, you can. So we just said that ProAuth is the preferred method of submission for our authorization request, and we're going to talk a little bit about ProAuth and what it looks like and how you get to it and how you sign up for it and all of the things. So if you're going to, that is the preferred method to submit an authorization request, and it does have to be accessed through the Provider Connect portal. And so you're going to log into ProAuth once you get into Provider Connect portal. Chrome is the recommended browser for ProAuth. And here is your Provider Connect login link, if you will, how you will get to Provider Connect to do your login. Logins and passwords, again, are obtained and maintained by your organization's local administrators. And the local administrator may inquire if there is login issues through Provider Connect support. That's who you will contact about any lockouts, login issues, that type of thing. So when you get into the portal, this is what it's going to look like. And so if you'll notice, you've got some quick links there on your left-hand side, and one of those quick links is ProAuth authorization. So that's what you're going to click on once you get into the portal to take you to the authorization portal. Once you get into ProAuth, if the link does not go to this page and it goes to a page that's blank, or you have an error message, it could be that you need to turn off a pop-up blocker and change the settings to always allow for this site. It may need to be done twice, but once the pop-ups are allowed, you shouldn't have to fix it again, and it should bring you directly to the welcome page, which is going to be our next slide. But if you'll notice in the top right-hand corner, that's where your settings are. So that's your browser settings. You're going to want to make sure and go there and allow that pop-up blocker for this site as a trusted site. So if you're logged in and this is the screen that you land on, then you don't need to worry about the pop-up blocker. That's already been done. And here you are. You're welcome. You've landed to Welcome to ProAuth. You've landed on the dashboard page. So once you get to the dashboard page, there's a couple of ways you can submit for an authorization request. You can do a member search if you want to and put in that member information, or you can go directly to the top right-hand corner where it says create an inpatient authorization or create a service or procedure authorization, which is an outpatient or ambulatory authorization. So if you go through the member search process, the options to create an auth are going to be the same, but they're going to be at the bottom of the page instead of at the top of the page like we saw on the previous screen. But either way, you're going to have the opportunity to create that inpatient authorization or that outpatient authorization. And it's going to want you to choose whether or not you're needing a behavioral health authorization or a medical or physical health authorization from this screen. There is additional on-demand trainings that you can go to learn all the things about ProAuth and how to navigate ProAuth, how to register and sign up for ProAuth. There are supporting documentations. There's Q&As out there for you to go look at. So here is your information. This is all links that you can go and watch the on-demand training specifically around authorization. So if that is your role at the organization that you work for, I would encourage you, if you're not familiar with this, to go out and soak it all in, get all the ProAuth training that you can get to ensure that you are getting the best results possible on the front end instead of trying to navigate on the back end. Next, we're going to talk about durable medical equipment, DME. So we do pay for DME, and we offer the same physical health services as the standard plans do and at Medicaid Direct. For the tailored plan members, you can request authorization for a DME using just what we talked about, the ProAuth tool and Provider Connect. The DME is built on a medical claim form. It's submitted using the physical health submission methods, which we will talk about a little later in this presentation. That includes any CPT codes that are on the applicable DME fee schedules, and here's a link that'll take you there so you can identify if that is where your code or your equipment or service is falling. So DME billed for the pharmacy point of sale, like diabetic supplies. They are managed through Partners Pharmacy PBM, which is CVS Caremark. And here is, there's a link there as well that can give you those items and how you will submit for those. When submitting a claim for manually priced DME items, then you need to attach an invoice to the claim for reimbursement review. You need to use the correct modifiers if it has a modifier that's applicable for whichever service that you are rendering. And those clinical coverage policies for DME are located in the links below. You've got your rehab equipment and supplies. You've got your, which includes your osteogenic stimulation. You've got your respiratory equipment and supplies, nursing equipment and supplies, orthotics and prosthetics. And those are, we also have a physical health DME provider guide that is located on our website, and there is a link here at the bottom of the page for that will go over all of this information in more depth and in more detail to help guide you through that process. Next, we're going to talk about Evolent, which is a utilization management program for our imaging services, non-emergent events and outpatient imaging. So it's formerly was known as National Imaging Associates Incorporated, and partners in its partnership or in our partnership with Carolina Complete Health, we use Evolent to provide the management and prioritization of those non-emergent advanced outpatient imaging services. So any service rendered after February the 1st, 2025 requires authorization for imaging. And only the non-emergency procedures, let's make a note of this, only the non-emergency procedures performed in an outpatient setting are going to require that authorization with Evolent. So here it gives you kind of a list to give you some suggestions as to what's covered. And here on the other side is excluded from the program procedures. They're performed in the following settings. Those would come in a different way. The next slide just gives you our time frames for authorization. So the time frame for determination for a standard request, inpatient, outpatient, urgent requests inpatient, urgent requests outpatient, and for retrospective reviews. So this just gives you the time frame for us to make a determination so that you know that if you haven't heard back from us in an hour from the time you submitted it, that it might be because we're bombarded with requests at that moment, but we have a time frame for that, so that keeps us all in check and keeps a balance going. That it might be, if it's an emergency, a standard service request, it has 72 hours to be responded to for non-emergency inpatient admissions. Excuse me. If possible, it should be requested at least 14 days before the scheduled service delivery date, or as soon as you know that service is identified as a need. More information about Evolent. Here is some radmd.com website information that you can access to give more information around what is required and to navigate that process for the RADMD access and features. Next, we're going to move into claims and payments, everyone's favorite subject, because we all know that whether you're getting paid is dependent on whether we can continue working, right? So let's talk about our claim submission process a little bit in this next section. So submitting your claims, you can submit your physical health claims through our Provider Connect portal. As you can see here, this is the dashboard or the welcome landing page that you will see when you first log in. There is the opportunity to submit a behavioral health claim or physical health claim. So you're going to click on physical health claims if you are submitting physical health claims. And it's going to then take you into our claims portal where you're able to then submit your claims according to the requirements, the claim submission requirements. There are electronic methods, paper methods through your clearinghouse or SFTP site to submit your claims through that 837 process. This gives you your physical health claim submission as well as your behavioral health claim submission processes. Please note that the payer IDs are different for physical health claims than it is for the behavioral health claim submission. That helps it route to the appropriate spot in our system to ensure that those claims get paid timely and don't get hung up in that front end process. So for physical health claims, EDI claims are submitted to payer ID 68069 as identified on the prior slide. You'll choose a physical health management, physical health 68069. As long as your clearinghouse has a connection to Availity, the claim should pass through smoothly and be processed by the physical health plan payer system. Medicaid claims should be submitted within 365 days from the date of service, which means that if you provide a service on January 1st, then you have until December 31st of the next year, or until December 31st of that same year, in order to get that claim in the system. I wouldn't recommend waiting 365 days, but that is the allowance just in case there's some reason that prohibits you from submitting those claims sooner. Provider Connect, you utilize Provider Connect to submit your claims through Availity for the Medicaid Tailored Plan physical health claims. If you are mailing in a manual claim, this is the address that you would mail in a physical claim to, P.O. Box 8002 in Farmington, Missouri, or that might be Montana. I'm not going to even try to say that I know that. And if you have questions about that, there's your phone numbers here and a fax number that you can also fax your claims into, or you can call if you have a question about that. For the clearinghouse and setup of new payers, for existing Availity trading partners, if you are currently sending EDI transactions for other health plans already through a secure FTP account with Availity, then you can follow your standard business process to work with Partners Health Management. If you need assistance, please refer to the resources in the EDI Quick Start Guide for Availity. That will give you all of the necessary guidance to get connected there and to ensure that you are moving it through the Availity system smoothly and quickly to make sure that your claims are getting paid quickly. If you do not already have an Availity account, you're going to need to register at Availity.com. Here's a link directly below. You're going to follow the registration process to ensure that you are connected with Availity's portal. There is a quick guide for Availity here that you can follow this link that tells you all the things that you need to know for navigation. and as well as how to submit a claim on the Availity in the Availity portal. We're going to move on to some reminders for specialized therapies, which include your speech, PT, and OT. Just want to remind that specialized therapy billing does require modifiers GM, GO, or GP to be submitted with outpatient specialized therapy services. They refer only to the services provided under plans of care for physical therapy, occupational, and speech, as I just outlined above. They should never be used with codes that are not on the list of applicable therapy services. And there is a CMS regulation and download that you can refer to here in this link that'll give you more information to ensure that you are billing those appropriately. Just note that there is updated billing guidance as of May of 25. Here's a link that you can view the latest guidance on determining whether or not the claim is going to be paid as physical health or behavioral health. And please note that if you have a rendering provider taxonomy, that is it's going to be looked at to determine if it's physical health or not. That's through the level 5 hierarchy, and that is all defined in that billing guidance guide. So I would encourage you to go out and look. That will help you to understand the routing for those physical health versus behavioral health claims, and if you have questions on how to ensure that those are being routed properly. We do have an initiative for clean claims to be resolved, which is finalized, either paid or denied, of 95% within 15 calendar days, and 99% of our clean claims should be resolved and adjudicated within 30 calendar days following the receipt of the claim. So that's based on the date the claim is received into the system. Carolina Complete Health AMH advanced medical home payments are paid out on the 20th of each month. Partners check run scheduled is weekly on Mondays, with payment issued to providers on Tuesdays weekly. And you can find those check write schedules out on the website for both physical health at CCH and for partners on the partners website. Your remittance advice, also referred to as an 837 if it's an electronic file, or an EOP, which is an explanation of payment, these are issued with the payment and can be accessed several ways. You can do that through PaySpan, or you will also receive a physical copy if you receive a paper check. I'm going to talk more about those EFTs and PaySpan and how to get connected with PaySpan. So for behavioral health, it's just going to break it down for a behavioral health claim because it could be that you have both. Please contact Partners Vendor Group for EFT and banking information at vendor setup at partnersbhm.org if you need to have that set up. And for physical health claims, you're going to use PaySpan. And here is a link to get to PaySpan's website. To contact PaySpan, here's a phone number that you can choose, or you can send an email to provider support at PaySpan, Monday through Friday, 8 a.m. to 8 p.m. You must register with each line of business that you have, and there will be registration codes that are specific to partners to ensure that that connection is made when you do that sign up, and that way you're ensuring that those EFTs are coming appropriately from partners over to whichever line of business they need to come to for your organization. PaySpan does offer monthly training sessions for providers that covers all of these topics that are listed here. How to register, how to add additional registration codes, how to navigate the system through the web portal, how to view a payment, how to find a remittance advice, how to change your bank account information if that updates, and how to add new users to that as well. And that registration information, again, can be found through this link at carolinacompletehealth.com and training. The electronic funds transfer, to dig down a little into that, here's again the PaySpan information that you can contact Monday through Friday. And here are again are the training opportunities that we just discussed on the previous visual that you can use for education and training around how to sign up, how to register, and all of the things to do with PaySpan. I'm just going to give you a couple little visuals here as to what it actually looks like when you go into PaySpan. If you're a visual person and a visual learner, then this will just give you some idea of what it looks like when you actually log into PaySpan. It's going to give you the opportunity to view your payments, to download it into a CSV, which you can then put into an Excel to filter whatever you need to do or drop into your system. So this is what it looks like. All right. Medical home payment and reporting, just some questions and answers. Where can practices find their medical home fee capitation reports? In PaySpan, you can click register and contact in person, and there's some attached guides that can help you understand and find your medical home fee capitation reports. What section of the portal should providers be directed to? Under payment details, you'll click view and then download the CSV as was indicated in the prior screen that showed you the actual screenshots of what those screens look like. To access the PM payment records, those are on the first of the month, so you'll need to make sure that that you have access on the first of the month, and the payments typically roll out on the 20th of each month. So if you've just signed up, just keep in mind that it could take a little longer because all the setup is happening, and those first couple months it could be a little later in the month if it's your first time accessing that through PaySpan. We do have a claims reconsideration process. We do work with providers to resolve any issues. There are times when providers dissatisfied with a claims processing outcome, and we just want to make sure that all providers are aware that we have a process you can follow. It can be as informal or as formal as you like that to be, so that we can help you navigate our system. We can help to guide and direct you if there are things that you can do differently. We can offer suggestions as far as to how that make that process smoother for that claims process. But if you are dissatisfied and you want to submit a reconsideration form, you are welcome to do that, and we encourage you to do that, so that we are then able to review any claims submitted on that form for accuracy and provide the research outcome, to provide that paper trail for you, if you will, to ensure that you have the outcome that you are desiring from those claims reconsiderations. And if you are still not satisfied with the outcome of that process, then you are encouraged to file a grievance, an actual grievance or complaint with partners. The claims reconsideration forms can be sent, as you see here, to the claims department. And a grievance can be submitted to our grievance email. And if you'll notice here, there is a link here to take you directly to our grievance page on our website, which I'm going to show you next. Here's our grievance page. There's a no wrong door policy for grievances. You can do that through phone number, or you can do that through U.S. postal mail. You can do that through email. You can do that from your website directly through our feedback, or you can do that in person. All partner staff are trained in how to take a grievance. They can take the information from you if that's what you request, or you can go through this formal process that hits directly to our grievance department. So just wanted to make you aware that that's available to you if you need to utilize that process. And again, in Provider Connect, you are also able to access our grievance form there, so that you can go directly through the portal and submit that grievance as well. Next, we're going to talk just a little bit about our provider communications. Would like to offer you the opportunity, and I would encourage you to go out to these links and sign up or subscribe, if you will, to our communications. That ensures that you get the most updated, the latest and greatest information that's come out, that's posted on the website for communication bulletins, alerts that may come out that is a little higher priority, if you will, information, or a more sensitive, time sensitive, if you will, that you can go out and you can sign up for those communications. And those are available to you as our providers, and they will come directly to your inbox in your email, so that you're able to receive those as they come out. Here's a provider support and who to contact. This just gives you some information on how to get in touch with us. If our provider services line, again, is our #1 line of defense or contact, if you will. If you have any questions provider related, and it gives you some examples of what you may contact our provider services line for. It does give you some options, some drop-down options to contact different departments, or you can always press 0 and get a provider services representative. They're always eager to help you, and they have answers to most of your questions unless they are complex, and then they may refer you over to someone to help with more complex issues. You do have some emails that you can use to contact Carolina Complete Health Network Provider Relations directly if you need to do that, or if you need to contact the engagement team at CCHN as well. There is some information around that as well. I think that was fast and furious. I do want to thank you for joining today. If there are any questions, we will get those answered. I do want to make note that, again, that this slide deck will be, it was recorded, so you're able to go back and pull that up if you want to go through that again as an on-demand. The slide deck itself will be posted so that you're able to go then access that. Please note that after this last slide, there are additional resources located within this slide deck. So I encourage you to go out there and look at the slide deck, because there may be some questions that you had that you didn't feel like that we answered, but they may be answered in our additional resources. We try to move more outdated items down to the additional resources, or more in detail information, if you will. So there might be some information there that's helpful for you. So I encourage you to go out and access that slide deck as it gets posted. It's usually posted within 24 to 48 hours of the office hours. And we do thank you again for joining, and we appreciate your time, and I hope that you all have a great afternoon.
Beth, real fast before we say goodbye,
Sure.
we have one question about Mobile Connect and how to find more information about that. Do you have any information to give this provider, or should we have someone from our team follow up?
I don't know that I have the answer to that. So let's get their contact information, and we will be more than happy to follow up on that. Absolutely.
Perfect. And just one more thing before we close. Of course, everybody could put their questions in if there are any questions. But lastly, our next session is going to be November 4th, same time, 12 o'clock. So if you feel like you want to come back and ask or have more questions answered, please feel free to go ahead and register and come back for that session.
Yeah. And I think I'll just remind people as well, Gaines, that if you have questions that you would like, or you have topics that you would like to see us cover in office hours, please feel free to offer those suggestions and recommendations as well. And we can look at adding some different kind of content if that's what we need. This is, we try to go with the hot topics of the day and items that we feel like are pertinent to your practice and pertinent to your success in our network. And we're welcome to suggestions as well. I'd just like to offer that as well.